Chapter 3: How to Care for the Smallpox Vaccination Site and Prevent the Spread of Vaccinia virus, with Dr. Brett Peterson.
In Chapter 3 of this training video, we will provide instructions on how to care for the smallpox vaccination site and how to prevent the spread of Vaccinia virus. Successful smallpox vaccination produces a pustular lesion on the skin. Vaccinia virus can shed from an active lesion until the scab separates from the skin, about 2 to 4 weeks after vaccination. During this time, before the scabbing occurs, proper infection control must be taken to prevent accidental self-inoculation or spread of the virus from the vaccination site to other areas of the body, and to prevent contact transmission or spread of the virus from the vaccination site to other persons through close physical contact. It is critical to educate vaccinees on how to practice good hand hygiene, how to properly care for their vaccination site, and how to properly handle and dispose of contaminated material. These practices will also reduce the chances of secondary bacterial infection at the vaccination site. Provide the following instructions. Vaccinees need to consistently perform thorough hand washing with soap and water or use of an alcohol-based hand rub solution, usually greater than 60% is sufficient, after any direct contact with the site and after contact with materials that have come into contact with the vaccination site or vaccine virus. This is one of the most important measures to prevent transmission of vaccinia to another person or another part of the body. Vaccinees are encouraged to wear gloves if available when caring for their vaccination site. Used gloves should then be disposed of in a sealed plastic bag with a small amount of bleach. Vaccinees will need to keep the entire vaccination site covered until the scab falls off on its own, which is generally up to 4 weeks but could be longer. This is especially important when handling infants and young children during breastfeeding or when participating in intimate activities such as having sex. Do not routinely use a non-porous bandage that blocks air from the vaccination site. This may cause the skin at the vaccination site to soften and wear away or lengthen the time of healing at the site. The vaccination site bandage must be changed every 3 days or sooner if the bandage gets dirty or wet until the scab falls off. This will keep the skin at the vaccination site intact and minimize softening. Dispose of contaminated bandages properly in order to prevent others from coming into direct contact with them. Vaccinees can do this by placing used dressings in sealed plastic bags with a small amount of bleach to kill the virus before disposal in the trash. Once the vaccination site scab falls off, vaccinees should also dispose of the scab in a sealed plastic bag with bleach. Immediately after proper disposal, hands must be washed. The vaccination site will itch as it heals. Vaccinees must make a conscious effort not to scratch or touch or pick at the scab until the scab has fallen off on its own in about 2 to 4 weeks. Vaccinees must avoid touching their eyes or other parts of their body when caring for their vaccination site. Vaccinees should also consider wearing long-sleeved clothing in addition to their bandage to help cover the vaccination site, particularly when sleeping, to avoid scratching the lesion or contaminating their bedding while sleeping. It is extremely important that others, including household pets, do not come into contact with the active vaccination site or contaminated materials from the site in order to avoid accidental spread of Vaccinia virus to household members or other close contacts and/or pets. Do not use salves, ointments, including topical antibiotics, or creams on the vaccination site, as these can cause an occlusive barrier that may cause the skin at the vaccination site to soften and wear away, which can prevent the vaccination site from forming a scab properly. Vaccinees should separately wash clothing, towels, bedding, or other items that may have come in direct contact with the vaccination site using hot water with detergent and/or bleach. Immediately after handling contaminated laundry, hands must be washed. The vaccination site needs to be kept dry, although normal bathing and activities can continue. A waterproof bandage can be used while bathing or exercising. The site should not be scrubbed. After bathing or exercise, vaccinees must remove the waterproof bandage and then cover the vaccination site with a porous bandage afterwards. If the bandage soaks through, then it should be changed. If the site gets wet, then it should be dried with a paper towel, gauze, or disposable cloth that can then be disposed of in a sealed plastic bag with a small amount of bleach before disposal in the trash. Immediately after a bandage change or drying of the site, hands must be washed. Do not use cloth towels to dry the site because they can spread the virus.